Hi, this is Dr. Laura Phan, and I do oculofacial plastic surgery in Saratoga, California. So yesterday we did a quick video on me placing twist PDO threads in the nasolabial groove here, in my marionette lines here, and immediately after, if you saw the video, you might notice how red I was and how scary looking it might appear. But a day later, here I am. So the redness lasted for maybe about an hour. By the time I got home, it was gone. What was still lingering was just a little achiness, such that when I ate dinner, I had to kind of be careful, cut into smaller pieces, didn't open my mouth too widely, just because it felt achy. And it lasted till this morning. So now I do have a bruise, a small one right here. I have a bigger bruise right here, and then a small, medium bruise right here. And I covered up with some cover up. And of course, once you start that Pandora box, you start looking at yourself, what else can I do? And so we did the lower phase to stimulate collagen for some of the volume deficit. Now I'm thinking, one of the things that bothered me about my neck is that I have these loose platysma band, which I injected neuromodulator into the band last night here. And for that matter, I also did Botox or neuromodulator to my forehead, glabella, my lateral brows to raise the brow up, crow's feet for the smile lines, and the masseter. So I did those injections last night. But for the loose skin here, Botox is not going to address the loose skin. So I'm thinking to place the smooth threads across here. So 3 on the side, 4 down the midline, that's 10. And then for some of the loose skin here, I was thinking carrying down the thread down the midline. Okay. So 4 and then 3 here. So, and then I was thinking doing something. Okay, so let's count this up. 4, 3, 3, that's 10. 10 and 3 is 13, 13, 14, 15, 16, 17, 18, 19, 20. I opened up 24, so we can kind of do something like that. And I'm gonna chloroprep my skin. I'm gonna sterilize my skin here. I'm not putting numbing cream on just because I'm too lazy to wait for the anesthesia to take effect. But of course, when I do it for patients, I would put the numbing cream on for at least 20 minutes up to an hour, and then I would do the procedure. And then, of course, I would put on gloves, but I'm doing it myself, so I'm skipping a lot of the typical protocols. Okay, so I'm not going to be talking while I'm putting this in, just because I don't want to move my anatomy. And so I retract the skin, poke, and then advance the thread, and same thing here. I'm going to retract. Advance. A poke, then advance. I see there's a vein right there, so I'm going to try a different spot to avoid that vein. Okay, so I removed the threads there because it was getting in my way. I usually like to remove them all at the end. And so it's getting in my way, so I went ahead and removed them. Now I can kind of see what I'm doing. And the vertical is harder to do for me because I have to really keep it parallel to my neck contours. I think the easier approach would be for me to do it from the side because it's easier for me to see the plane. So instead of doing the vertical like I was thinking, I'm going to do them horizontally across, like diagonally across, like this way. Okay, so I have about 10 here, about 3 here, 1 here, 4 and 4, 4 and 4. So now I do have a few left, and I'm thinking right about here where the skin tends to get loose from just the million of swallowing that we do, movement up and down that we do here. I might just carry down. All right, so that's 24 of the smooth PDO threads into my under chin and neck area. And the goal there is not necessarily to, like up here, fill in these grooves, but rather to just stimulate collagen and tighten up the skin that neuromodulator would not affect. So neuromodulator would affect the muscles that are loose here, but then residually you have loose skin, and so I'm just trying to stimulate collagen into that area. So join me in the next segment, and it'll be a surprise. I'll think about what I want to do next. Thanks for joining. Bye.